in substance use disorder. The majority of people recover to controlled use, which is shocking for a lot of people because we've really been steeped in the AA culture, and God bless AA. I love it for the people that it's for. It's remarkable. It's not for everyone. The concept of complete abstinence only or you're failing is a dangerous concept.
Welcome to Spread the Light with Dr. Devika B, where we unpack stigma, stereotypes, and bias as they relate to mental illness. Because stigma festers in the dark and it scatters in the light. I'm Dr. Devika Bhushan. I'm a pediatrician, a public health practitioner, a parent to a toddler, an immigrant to the US from India by way of the Philippines, and somebody who lives with bipolar disorder. Today we have on the show a friend of mine, Dr. Nzinga Harrison, who I know you will all love meeting. She's a board-certified physician with specialties in both psychiatry and addiction medicine. She is the chief medical officer and co-founder of Eleanor Health, an innovative mental health and addiction treatment company that we'll learn a little bit about today. And she holds a faculty appointment as an adjunct professor at the Morehouse School of Medicine, as well as sitting on the Practice Management and Regulatory Affairs Committee for the American Society of Addiction Medicine. She's written a brilliant book called Unaddiction, which we'll talk through today. It walks through 6 mind-changing conversations about addiction and recovery that could save a life. And that book, just for what it's worth, sold out at NetCon. Right after Nzinga did an hour-long session walking through the key lessons from the book. So welcome to the show, Nzinga. It's so good to have you here.
Thank you, Devika. I'm glad to be here. Beautiful introduction. Thank you.
No problem. So let's start here. It's a story that you speak about early on in the book. You talk about being a medical student, taking care of patients who are waiting for a liver transplant. And you learn that people with alcohol use disorders have to have that disorder in remission for at least 3 years to even be eligible for a liver transplant. And you also learn that patients with other diseases are not held to that same standard. And you say the lives of people who use alcohol and drugs don't matter to the healthcare system. Pretty damning revelation and realization for you to have at that point in your medical career. So can you talk us through that moment and what else led you to become an addiction and recovery specialist?
Yeah, I think that really is the moment. So I went to medical school with the intention to be a pediatric surgeon. And, you have to rotate through all of the different specialties. And so I went to my 6-week psychiatry rotation, dismayed that I even had to do it because I was like, I could be doing surgery right now. But what I really found was even before the system doesn't care about the lives of people who use alcohol and drugs was the system really was built in a way that was legitimately harming and killing people that had mental health conditions, and then just like step that up a notch when I did that liver transplant rotation. And so I was raised an activist, and that really tapped my activism bone. And I felt like this is, a population of people or a community of people that I could make a difference for. I don't even know how I landed on the liver transplant psychiatry team because I was not looking for an addiction rotation. But thank goodness, shout out to Dr. Bob Weinreeb, who is amazing at the University of Pennsylvania. I just went home feeling so heavy every day because we did all of the liver transplant psych evals, pre-transplant evals, and it just became shockingly, amazingly clear so fast that if your liver disease was from anything other than substance use disorder, it was easy to just say psychiatrically cleared, going on the list, no problem, right? And they had their very objective other medical criteria that decide whether you can get on the list or not. But when a person had a substance use disorder, whether in remission for years or not, It was like we were legitimately having to put on our hardest core advocacy skills with other physicians to prove it felt like why this person deserved to live. And that just really bothered me deep in my soul. And like root cause analysis on it was, especially, I mean, to date myself, this is back in what, 2000, duh, don't even add any more numbers after that, back in like 2000. So this is 24 years ago. We still have a long way to go, but 24 years ago, like substance use disorder as an illness, very small kernel of people who believed and understood that it was a moral failing. You make bad decisions. We can't trust you to take care of this liver. This idea that people don't recover from substance use disorders. And so it was just like the tallest stigma mountain. And I just legitimately came away feeling like the system doesn't care if these people die
Right.
or not.
Right. Absolutely. And back then, 24 years ago, that stigma mountain was steep and high, and it still is very
Hmm.
large. And you talk about this on many different levels, but maybe let's start with what happens when you explain the St. Kitts monkeys to a new patient as they're coming in to understand, their path.
So, and at Eleanor Health, we call the people we take care of community members. So I've kind of like
Love it.
moved from patients to community members
Yes.
with this idea that community drives health and we want to see our people as more than their diagnosis. That's our thinking for that language.
Love that.
And so, but
Community
over
health.
the years, as patients came to my office and now at Eleanor Health, as community members come to us, they carry all of that stigma internalized, right? Like they believe they're bad people. They believe they don't have willpower. They don't trust in their own intuition. They don't understand their ability to make decisions and their right to make decisions about their own behaviors and their health. And so I tell this story in the book, the St. Kitts monkeys. And what's so funny is my sister's partner is from St. Kitts. So when I got the first print of the book, I like tabbed it off and gave it to him. And he's like, we see these monkeys all the time. They're like really known, but there's this study on these monkeys, and they range the entire range from teetotalers. Like some of these monkeys don't drink alcohol at all. And then you have a group of these monkeys who drink socially. And so they'll like on the resort take a few drinks from tourists, but they're like social drinkers and they only drink with other monkeys and they don't drink alone. And then you have a group of these monkeys that legitimately drink themselves to death. So they like steal the tourist drinks and they get into drunken brawls and they pass out and you like walk by these monkeys that are passed out. They're called the vervet monkeys. And so when we think about alcohol use disorders and other substance use disorders in humans, we can't help but think about the choice, right? And so we over index to the choices that people are making. And like, just look at American culture, the choice to use drugs is a choice that a majority of people make, whether that's caffeine, alcohol, cigarettes, vaping, marijuana, etc. Drug use is a choice. Substance use disorder is an illness. And so when I talk to my patients, community members about the vervet monkeys, it's a lot harder to be moralistic about monkeys than it is to be moralistic about other humans or even to be moralistic about yourself. And I say, let's think about, the biological inputs that answer the question why some of these monkeys are teetotalers and why some are social drinkers and why others drink themselves to death. This is the same thing we see in humans.
We're on.
So when I'm talking to patients in the past or community members now when they come to Eleanor Health, I use this story because it's so much easier to be moralistic about humans, other humans, or yourself than it is about monkeys. So we initially start out laughing, and then I'm like, those monkeys suck, right? And they're like, the monkeys don't suck, they're monkeys. And I'm like, okay, there must be some reason. Okay. And we start to try to use that to unravel that internalized stigma and shame and judgment that will undermine a recovery process. So, helping folks understand there are real biological reasons that all illnesses develop, substance use disorders included.
And that is just really validating and empowering because it helps people see that it's not completely of their own creation or will, that it is actually, you say, 40 to 60% rooted in biology and also 40 to 60% rooted in actions that you can take. Both sides are really empowering, but really the basis for this illness, just like every other illness, is really that it is a biologically rooted set of processes. And
That's right.
and you talk through in the book that 75% of people recover from substance use disorder. And you talk about this very powerful concept of pre addiction, where substance use is still in that mild or moderate range. And then you liken it to pre diabetes, right? That if you get that signal from your doctor, then you're suddenly able to make changes to your diet, your exercise regimen, to the way in which you're sleeping, your stress levels and behaviors. And then you can work to stave off diabetes. And similarly, you could do the same exact thing with substance use disorder. So tell us what you recommend when somebody walks in and they're in pre addiction.
Yeah, so shout out to Nora Volkow over at SAMHSA for really putting this concept of pre-addiction out into the world. I say in the book, and I maintain, I wish I had thought of it. But like you said, it gives us an opportunity to practice a little bit of prevention. So unfortunately, now when people hear addiction or think of addiction or substance use disorder, it's really what I call that stage 4 metastatic illness, right? Like it's the severe, you've lost your family, you've lost your job, you don't have any money, your health is failing, you've had multiple attempts at recovery and still struggling. That's what people think of. But if you look at our diagnostic criteria, there's a whole range where you just think to yourself, am I drinking too much? Would I feel better if I stopped smoking? Am I spending too much money on edibles, right? Like you just get that ping. And I tell folks, if that question even comes to you, either out of your own brain or somebody who cares about you, even ask the question, this is an opportunity before it becomes that severe illness, and the ability to make decisions around the substance really does get damaged, like while you still have the power to change and prevent an addiction from happening. And so, to answer your question, what do I recommend people do? First, score yourself. So, I introduced the cage in the book, which is just a 4 item questionnaire. Have you ever felt you should cut back? That's the C. Have you ever been annoyed when somebody else had the nerve to say something to you? That's the A. Have you ever felt guilty because you're like, dang, I said I was only going to drink 2 glasses of wine and I drank the whole bottle? That's the G. And then the E is an eye opener. First thing in the morning, do you need to either use that substance or that substance is on your mind? Just one yes, 79% of the time indicates a substance use disorder, whether that's mild or moderate. This is why we ask women to do their monthly breast exam, because we want to feel that lump while it's still in stage 1. Even if you then go get help, talk to a primary care doctor, talk to a friend, talk to a therapist, talk to a religious leader or spiritual leader that you trust, talk to a family member. The point is, talk to somebody, because in your intro, Devika, you said stigma grows in the dark. I'm paraphrasing, and scatters in the light.
Right.
And so when we have an illness, health is about community and support and stigma reduction. So the more all of us can say, I got a 1 on the cage, or I got a 2 on the cage, and I'm going to try to make some different decisions and some different choices before my illness is such that I can't, that starts to protect us and decrease, hopefully, the number of people that get to stage 4.
I love that.
So score yourself, talk to somebody. Notice I didn't say go to rehab. That's like everybody's scaredest. That's what they're scared I'm going to say is like 30 days of rehab for you effective immediately. So many other ways to get connected.
That is really empowering. And so is this idea that you present in the book that I think is novel to a lot of people in the addiction space, which is that you can support somebody to controlled use rather than total abstinence, right? And that's a shift in the field. And I'd love to hear you talk more about that, as well as how you take that approach at Eleanor Health.
It's a huge shift in substance use disorder. It is not a shift at all from the way we practice medicine for every other chronic condition, right? So if I have diabetes and I first, meet my primary care doctor and they're like, oh, your A1C is 12 and our goal is for it to be less than 5.5. 12 weeks later, if I come back with an A1C of 9, we're celebrating the progress, right? I didn't recover to completely normal A1C, but my A1C came down. That decreases my risk. This shows that the, efforts that I'm making, I'm getting positive reinforcement. This just happened to me, by the way, myself with my cholesterol. Oh, I think I shared that I just got diagnosed with high cholesterol.
Yeah, I think you
So I
did on
started
social
doing
media.
yoga every day.
That's
I cut
amazing.
sugar out of my diet. I started reading labels. And now my cholesterol is down to 185, which is like just under normal, still
So
higher than
good.
I want.
Yeah,
But I am not throwing this progress out the window, right? Like, this
amazing.
is amazing. And so the majority of people recover to controlled use, which is shocking for a lot of people because we've really been steeped in the AA culture. And God bless AA. I love it for the people that it's for. It's remarkable. It's not for everyone. The concept of complete abstinence only or you're failing is a dangerous concept. That's the same thing as it doesn't matter if your blood pressure came down if it's not completely normal. It doesn't matter if you cut back your smoking from 3 packs a day to a pack a day when we know it matters. It doesn't matter if you were using heroin 4 times a day and now you're only using heroin once a week. It matters because that was 28 overdose risks to now only one overdose risk, not to mention that was really hard to make that progress. And so I'm just like compelling not just the medical community, but everyone who is supporting people with substance use disorders. We have to respect their autonomy to make their decisions for themselves. We provide education. That's what harm reduction is. Empower them with the information and support to make the decisions towards their own goals. That's how we start to bring it into the light.
That's amazing because it really centers and empowers the choicefulness of the actual human being sitting in front of you, right? And it's not this outside in imposition that there is only one way to recover from a substance use disorder and it looks like this. And if you don't meet this threshold, then you have failed as a person
That's right.
or as a person with an illness, etc. And I think that is
Yeah,
just, you're so right. Now making it normal to say, okay, you can have a goal of controlled use, and that is a goal that we, the medical establishment, will support you in
mhm.
choosing, is exactly akin to the way that we treat other kinds of chronic illnesses that we don't moralize about.
That's right. That's right. And you asked at Eleanor Health how we operationalize this. And so when you come to Eleanor Health and you're seeking support for a substance use disorder, the majority of people coming to us are using more than one substance. And so we set an individual goal for each substance. And so a very common combination will be like, I want to stop heroin or pain pills completely. I want to decrease my alcohol use to only be on the weekends. I am going to keep smoking marijuana whenever I want to. It's like, all right, so let's talk to you about the risk of smoking marijuana and how you keep yourself safe. Let's get some medication on board and get you with a therapist and a peer and a social support so you can get that complete abstinence from the opioid. Let's think about a medication or, AA or other support system for the alcohol use disorder. And then, by the way, let's talk about depression, anxiety, trauma, life stress, all of the other things that make it hard to manage any chronic condition. But even when we look at our drug screens, it's like, not is this drug screen completely negative for all substances? Does this drug screen match your goal?
Mm.
And if your goal is controlled use, right? Let's say marijuana, you say, I'm just going to smoke socially with my friends on the weekend. But every single drug screen on Tuesday is positive for marijuana. That's not your goal. We didn't set that goal for you. So let's circle back and figure out what's preventing you from getting to your goal, because you're using daily multiple times per week for your drug screen to be positive, and really empowering people. I love your word. I'm going to steal it. Thank you very much. With that choicefulness is one of the main ways we degrade people with substance use disorders, is we start to believe they don't have the ability or the right to make their own choices. And when you remove that choicefulness and that agency, you're driving illness, not health.
Yeah, absolutely. Because people internalize the expectations that are set out for them, right? So if you're hearing from your physician and your other support systems that you're not going to make it, or the choices that you're making that you want to make, or the goals that you have for yourself are actually not matching, some other standards that are set out for you. I mean, it's just setting everybody up for failure in that
Yeah.
situation. And I love the way in which also you talk about including family members in this new choicefulness empowerment narrative, where you're separating the illness from the person, right? And you actually give words to, how do you talk to a little kid about this? We're mad at the addiction, not at daddy. Daddy is this
Uh-huh.
amazing, wonderful human being who loves to joke around. He's kind, he's reliable, and the addiction has stolen him, that version of him, from us. And I'd love to hear you talk a little bit more about, how do you approach this with teenagers, your own kids? How do you talk to family members in general to bring them into the fold?
Yeah. Thank you for bringing this up. This is actually, that's one of my favorite parts of the book, are the scripts that we lay out to talk to your kids at every single age. Because first of all, people are like, what do you mean talk to my kids about drugs when they're 4? I mean, talk to your kids about drugs when they're 4.
Yep.
Okay. And here's how you do it. I'm not sure if I told this story in the book, but my son was in pre-K, so he was 4. And I went to career day at his elementary school, and I spent 30 minutes in every grade. I was like, I'm a doctor. I even wore my white coat. I'm a doctor. I specialize in the brain. My specialty is addiction, and this is what addiction means. And then as I got to the older kids, and by older, I mean second grade, I'm like, who knows what addiction is? And they're like, do you mean like when my daddy's hiding his cigarettes in the trash because he doesn't want mommy to know he's smoking? Or do you mean like because my daddy went to jail for using cocaine? Or do you mean these are second graders?
Yeah.
So
Kids
they
know everything.
already know
Mhm.
everything.
Mhm.
And it can be so hard because the symptoms of addiction are feelings and thoughts and behaviors, and they sit between us and the person that we love. And we start beginning to think we hate our person,
Mhm.
when really we hate what this illness is doing to our person, but then we start shooting our person.
Yeah.
Right? And so I
Yeah.
have this concept of like, there's you, and then there's the addiction in the middle, and then your person's on the other side, and you think you're shooting addiction, but the bullets are going straight through into your person. Like, let's reorient that so that it's you and your person over here,
Mhm.
and addiction is over there, and we're both shooting at addiction. And so the reason you start having that conversation at 4 years old is because young kids are developing their concept of what it means for a person to have addiction. And we want them to have the concept of a beautiful, amazing person with exactly the same value that each of us has is being tortured and struggling with this illness. And we're mad at the illness. how do you have that conversation? And so started having that conversation really young with my own kids. And it was really important because we have a very significant family history of substance use disorder coming from both sides. And so, like, if 40 to 60% of your risk for developing the illness is coded in your DNA the day you're born, we're definitely on the 60% in range of that. And so I just started equipping my kids with this compassionate narrative, understanding addiction as an illness. And then as they got older, and so what does that mean for how you keep yourself safe? Because at some point, the pressure to use drugs as an adolescent is a normal pressure that is going to come. So, what does it mean for your friend to do a line of cocaine versus what it means for you to do a line of cocaine? What does it mean for your friend to take a pill versus what it means for you to take a pill? So that can empower them with the choicefulness in the moment to react to those situations, but then also just making it safe. The book is called Six Mind Changing Conversations That Could Save a Life. Conversations save lives. If your kids can come home and talk to you, if
Yeah.
your loved one can come home and talk to you, if your colleague can slack you at work and talk to you, that conversation has the ability to save a life purely just because it could happen.
Yes. Amen to that. So, at what point in somebody's recovery journey, as you're bringing a new community member on board at Eleanor Health, do you get the family involved? Is it in that first conversation? Does it depend on the person? How do you think about that?
Yeah, we try to do it first, but this is really, again, choicefulness,
Yeah.
right? So we know this is, again, empowering people with information. So we know that if you have a support system, you are more likely to get in remission and recovery from whatever chronic illness that we're managing, substance use disorders included. So in our very first conversation, it's like, who is there to support you on this journey? And can we bring them into your care? And, sadly, a lot of people don't have someone that they trust. So we're like, okay, how do we help you find someone that you trust? And then other people absolutely do. And we try to wrap them in from the very beginning. But that has to be, again, the choice of that person because we talked about the biological inherited risk factor, psychological inherited risk factor for substance use disorders is childhood trauma for sure. And so a lot of folks that we're dealing with have experienced really significant childhood traumas that rightfully decrease their ability to trust that they can safely be connected to other human beings. And so, from a trauma informed perspective, which we call it our core four at Eleanor Health: equity, harm reduction, trauma informed care, and teamwork. From a trauma informed perspective, you have to see that power in the hands of the person that is seeking care. Otherwise, you're another person doing something to them that they didn't consent for.
That makes a lot of sense. And that brings us to segue to another set of topics that you explore in the book, which are really around how traumatic as well as protective experiences can shape risk and health into the adult years, as well as potentially for the next generation. And you also share your own history of both traumatic experiences and protective experiences. And I'm curious, if you reflect on your own journey, how do you feel like your own specific health journey has morphed into superpowers for you potentially today?
Oh, I love this question. So, you referenced the ACEs, Adverse Childhood Experiences. Any score, it's a 10-item questionnaire that can predict your development of a number of chronic conditions in adulthood, addiction included, premature birth, cancer, asthma, etc. So any score over than 4 really represents a risk for developing these illnesses later in life. And the higher your score, the higher your risk. So my score is 5. And I actually use my own experiences to help people understand how to score themselves on the ACEs. And so, look, my score is 5. And I already told you about my biological risk, substance use disorders on both sides of the family. So I am biologically and psychologically loaded to have a substance use disorder. a lot of what we don't learn are the positive childhood experiences, PCES, affectionately known as pieces, the first being ACEs. And so the pieces are 7 different childhood experiences, like 2 adults that weren't your parents that cared about you, felt like someone stood up for you in hard times, felt like you could talk about your emotions at home. And a PISA score of 3 or higher begins to mitigate the negative risk of that ACEs score. And so I mentioned in the book, I had a high PISA score. My PISA score is actually 7 out of 7, which is incredible, right? And I think that 7 out of 7 is the reason I don't have a substance use disorder today, because trust me, if we knew about pre-addiction in college, Nzinga could definitely have been diagnosed with alcohol use disorder, mild in college. I was captain of the cheerleading squad and I missed homecoming, not because I was hungover, but because I was still passed out from being drunk, right? So like, and then after that, I was like, oh, okay, I got to stop drinking like this. Like, this is crazy. But those pieces kind of enabled and protected me from what could be a very different set of diagnoses to have today. And so I tell the story in the book because we put so much stigma. People will be like, oh my God, what do you mean you were the captain and you missed, homecoming? Oh, you're aces, right? And this is also one of my favorite parts of the book, because even people who have not had their own experience with substance use disorder or addiction see themselves in the aces part
Yeah.
of the book.
Yeah.
It has like been so validating and so reinforcing for people that those experiences actually matter. And the pieces, I talk about how to get your pieces as an adult in place. Even if you didn't have pieces in childhood, adult pieces can mitigate your childhood ACEs. And so, like, how do we get that support emotionally, socially in place that starts to undermine the negative impact of those ACEs? So yeah, that was another one of my favorite parts of the book, because this book also is about practicing generational prevention. And so, like, sat down with my husband when those kids were born. And I was like, we want to try to keep the ACEs score as low as possible. We don't have control over everything, so it might not be able to be 0. We have control over these pieces. So, like, our goal was 0 ACEs, 7 pieces for these kids. And periodically I scaled them from their perspective. I'm like, all right, what do you think about your ACEs score? What do you think about your pieces score? Do we have any opportunities here?
I love it. A CEO and CEO meeting of the house. let's evaluate our progress.
Exactly.
That's amazing. And people who listen to this podcast will know this about me already, but part of my history is that I worked on establishing the ACEs Aware Initiative in the state of
Mm,
California. We know that, 2/3 of the population, when you look nationally, will have experienced at least one ACE. And ACEs are not destiny, right? So PCEs are protective, connections in adulthood are protective. And then there's a variety of other behavioral self-care tools that you can amass to really rewrite the way in which your stress biology has been configured by your past and your present stressors. So that includes things like an anti-inflammatory diet, being in
yeah.
nature, having mindfulness practices that you can call upon regularly, exercising, getting enough high quality sleep, connection, of course, being a central component, but that there are other tools, including coping skills and mental health supports and therapies that you can rebuild kind of your toolkit and help to recalibrate the way in which your body is processing stress and reacting under stress, even today in the present moment. So, nothing about your past is prescriptive. It's all information that you can use, as you
Yes.
said, Nzinga, to really help figure out what you need to do today to stay healthy.
I would say, first of all, okay, I have 2 phrases that I have stolen from you today. So, number 1 is choicefulness. And number 2 is your aces are not destiny. Like, I would say, so many people have asked me, like, what's the one thing you want people to take away from this book? And I've said a lot of different things. I feel like you just said it, Devika, which is like, Your past is just information to empower yourself with so that you can go get the skills, go get the mindfulness, go get the stress reduction, go get the therapy, go get the medication, go get the support system, go get all the sunlight, the exercise, the sleep, like go get all of those things that empower you and put you in a position to choose health going forward. Because when we don't know, it's kind of like so scary, the idea of getting diagnosed with addiction
Yeah.
or substance use disorder or pre-addiction
Right.
or just answering one answer yes on that cage. Once we have that information, the power we have just harnessed to be able to put ourselves on a different path.
Yeah.
That's the destiny,
Yeah.
right? Not all of those things that happened before.
Absolutely. I love that. And I know that there was a lot to unpack in that specific set of concepts to walk through, but I wanted to bring it back to one aspect of the question, which was how do you feel like your own journey shows up in your superpowers today?
Oh, how does my own journey show up? So I first saw a psychiatrist to see what it feels like to be on the other side of the chair. In residency, they're like, everybody get a psychiatrist so you can see what it feels like to be the patient. And I went in and I talked to her. And so she's doing my childhood history and I'm telling her about all the things. And she's like, do you recognize how outside the normal bell curve this childhood is? And I was like, no, right? Because I think I was resting in those pieces, but like my father was commander of the Black Panther militia. He was a Vietnam veteran with PTSD. He had an alcohol use disorder when I was growing up. My grandmother had an alcohol use disorder. Like lots of things went down, right? And I just didn't have the concept. And I think this shows up in my work with other people. You said 70% of people have at least one ACE. Like, let's normalize the childhoods that we have. And that doesn't mean to say it was a healthy childhood and this is the childhood that we're trying to create for our children going forward. But like, let's recognize that that's not under the bell curve
Mhm.
of healthy
Mhm.
and the impact that that can have on us. And so that was a really meaningful experience, that first psychiatrist that I saw. And then I think really seeing aunts and uncles and my grandmother with addiction and seeing kind of, two different sides of the family. One, the approach was like very open and we knew who had addiction and we loved them and you could come home, but there were compassionate boundaries. The other side of the family was like, we don't talk about that, right? And you like saw the difference there. I think that comes into the way that I care for people because for me, the choice is talk about it. Don't stigmatize it. Don't make it go in the dark. Love the person, set compassionate boundaries. And so that personal experience definitely comes in. And then being raised an activist, like my dad was commander of the Black Panther militia in Indianapolis, Indiana. And it was like, you do not sit silent when you see people whose voices have been taken and they are being mistreated. You speak up and you do something about it. And so, like, I feel like that's founding Eleanor Health. That's writing this book. That's how I talk to every single one of my patients, community members. It's like, I'm like cheerleader, hype man. And no matter what you've been through, no matter the things that have happened to you, your innate value and your power is within you. So let's harness it. So I think all of that personal experience comes into my approach today.
I love that. Thank you. So, maybe just a couple of final questions. One is around this concept of compassionate boundaries, right? How do you explain this to both the community member that you're serving as well as the family members who want to help that person meet their goals? So, what does that mean to set a compassionate boundary?
Yeah, so boundaries are important. We need boundaries to keep ourselves psychologically safe. We need boundaries to keep ourselves physically safe. Many different illnesses comes with things that threaten those boundaries. Substance use disorders and other addictions certainly do. I was talking with a friend, and I'm always stealing phrases from other people. So I'll be like Diana Kutaya. She said, empathy is not endorsement.
Mm,
So I can have, in that
love that.
powerful, I will always have empathy and I will always have compassion. And that also does not mean I'm endorsing the harmful things that a person is doing, whether it's to themselves, whether it's to me, whether it's somebody else, for whatever reason that is. I can understand how you got here and have empathy that you're suffering and also set a compassionate boundary. And so one of the examples that I give really is my maternal grandmother. Like, she was incredible. My uncle, who let me tell part of his story in the book, which is so funny. He's like, now everybody's going to know I'm your favorite. That's really what the problem is going to be. Um, but, it was very compassionate. It's like, when his addiction was very severe, you can always come home. You're my son. I love you. You cannot live here because it is not psychologically safe for me for you to live here. That is setting the exact same boundary. You cannot live here. But the way many people have been taught to do it with tough love is get out of my house because you're a bad person making dangerous decisions. And I don't support that. And I don't support you. It's the same boundary. One is delivered in a way that is compassionate and sets the foundation for a different set of choices to be made. One sets it in a way that increases risk for a person to be disconnected and hopeless and shameful. And so I don't know how you feel about unpaid endorsements, but this organization called We the Village really supports loved ones and families in learning how to set compassionate boundaries. It's like your own recovery journey. And I think that is so important because the more we can get away from this tough love, disconnection, shameful, stigmatizing approach that we've been trained in, the more we can get to compassionate boundaries for psychological, emotional, and physical safety, the faster we can get to recovery paths.
Amazing. We'll definitely link to that organization because this is an area where I think family members definitely need help. It's their journey as well as the person who
Yeah,
is affected by the illness directly. So thank you for that. So,
that's
final
right.
question here for you. As you look to the future, what gives you hope?
So many things. Okay, I won't make this an infinite long list, but I will quote Michelle Obama from National Council Ending Conversation. And she said, I said I'm going to quote her, but I might paraphrase her. Something like, we don't have the luxury of getting disenchanted because the next generation is counting on us to light the path
Hmm.
of optimism. And so that's how I approached life. So, legitimately, what gives me so much hope is that compassion is in the front of the narrative as we talk about addiction. That was not the case 10 years ago. Harm reduction is at the front. That was not the case 5 years ago. Racism and discrimination is at the front of our conversations. That was not the case 6 years ago. Abstinence as not being the only successful outcome was not at the front of the conversation. We're still getting there. We're working on it, but it's like coming, I'll say it's like in the middle of the conversation now. Virtual care makes me super optimistic because it gives people a way to connect, especially in rural communities or other communities where, like, it opens up the whole web for you to connect with someone you feel like you can connect with besides just having addiction. I could go on and on and on and on, but the very first one would be that compassion is at the forefront of the conversation about addiction, and that's new. And
Right.
I think that's the first step on the path we need to be on.
I love that. And really, we're living through this culture shift moment, which is super exciting on so many different levels around serious mental illness, around addiction, around all of these very stigmatized experiences that classically have been shamed and blamed and not really spoken about. And now we're starting to find new ways of talking about it. We're starting to engage people in their own care in ways that haven't been classically turned to. It's a really inspiring and motivating moment, I think, in this field.
Agree. Agree.
Thank you for everything that you're doing. and for all the ways in which you are spreading the light with the person that you are.